Youth Coordinator Sonia Tyron says she was destined to work for I-Famagu'on-ta. This former Department of Mental Health administrative clerk mentioned she has a special ability interacting with the youth and their families. After guiding 19-year-old William Maka to achieve his goals, graduate from this system of care, and from high school, she's probably right. Currently, I-Famagu'on-ta serves 5 to 21-year-olds that have serious behavioral, emotional, and even academic problems. The program works by bringing a network of services together in one setting. Sonia also says the youth are involved so they can be able to make their own choices.
It takes a team to make it a success. Not one individual can do it on their own. But you also need the youth to be involved, because if the youth is not involved in any of those decisions, you're really making decisions for them and not knowing whether or not it would be successful in the end.
As a youth coordinator, Sonia supports young people in many ways. She is also in charge of transitioning kids who have graduated from the Wraparound program, an outlet that involves working with RAP coordinators, social workers, community leaders, and professionals. Director I-Famagu'on-ta says the Wraparound program brings needed services directly to children and their families and is a critical part of I-Famagu'on-ta's success.
It's like a one-stop place, right? So it really works, and studies have been done in the States, and it is considered a best practice model.
So how does I-Famagu'on-ta impact the community? A recent study based on data collected over a 2-year period shows the average age of children the program serves is 12 years. 75% are male and 77% are of Chamorro descent. About half live in a family with a history of substance abuse, while 52% have witnessed domestic violence. But statistics also show that 57% of children under the program improved in the school performance category. Juvenile delinquency also dropped 33% in that 2-year period. Given all this valuable data, Sonia says it's rewarding to know Guam's system of care has a positive impact on the youth.
There's other youth that have been successful, and we're equally proud of them. And you know, it's that feeling that you get knowing that you caring for this one person made a difference in their life. You know, it's just so fulfilling.
In the 4th and final installment of this series, we address what officials are doing to preserve I-Famagu'on-ta, and if the grant that supported the program for the last 7 years can be renewed. I-Famagu'on-ta, Guam's system of care, works. Throughout this entire 4-part series, the faces behind the program and the clients who grew up in the system shared their perspectives on the success of this system of care. But now, nearly 7 years after the division was established under the Department of Mental Health and Substance Abuse, the federal grant that funded the program will run out in September. Director I-Famagu'on-ta says they can't reapply for the $9.5 million grant because it's a one-time deal. However, they are trying to apply for other grants and request the help of lawmakers.
So as far as where's I-Famagu'on-ta in 2010 and forward, we're working diligently with our Department of Mental Health to sustain the family partners, the RAP coordinators, and hopefully with the legislature and the governor of Guam, we can get some money to develop and implement the other array of services that we don't have.
I-Famagu'on-ta mentions additional services such as respite and foster care treatment, as well as crisis response, could be part of the program's future. But in the meantime, Mental Health Director Dr. David Shimizu says the cost of running I-Famagu'on-ta will be factored in the agency's 2010 budget, if it's justified.
Yeah, I'm going to cover it. And I want to see just what, it's not a blanket. My program people in that area must justify.
Dr. Vince Akimoto believes saving I-Famagu'on-ta is already justified. After seeing numerous patients walk through his doors that he can't treat, he knows the program services saves money in the long run.
This is an important program that makes it less necessary to have jails for kids, less necessary for families to go to court, less necessary for people to go to the emergency room because somebody got beat up at school. This thing saves money.
And after working for 9 years with the island's young people, Youth Coordinator Sonia Tyron says she still believes in Guam's system of care.
If people believe in it, it will work. And if it's done properly.
In the end, William Maka, one of the program's greatest success stories, reminds all that the future of I-Famagu'on-ta does not lie in one person, but the entire community. Only then will it be a system of care and a system of success.
If you put all your minds together, you can create one great gift.